I'm 24 years old.
I just turned 25 this year.
I am 27 years old.
I'm turning 28 this year.
I'm 32 years old. Why did you choose CU-MEDi?
I chose CU-MEDi because it is a unique opportunity for someone from a totally different field.
And here there's a people from science and non-science background.
I believe that it can make me a great doctor.
What do you like most about the CU-MEDi program?
I like that we get early exposure to clinical years.
I really like the dynamics between classmates because we have different age and all come from different backgrounds.
Hello and welcome everyone to the CU-MEDi Open House 2023. My name is Seri Yampong-Sai, an American board plastic surgeon and one of the instructors of the CU-MEDi program. I will be your host today. During this session, we will introduce you to the International Medical Program at Chulalongkorn University Hospital, or CU-MEDi. We are a unique and alternative pathway to become a global doctor fits for the 21st century. During this session, you will learn the overview of the program and our readiness to bring you to your journey to become a cutting-edge doctor from our senior faculties and world-renowned international faculties. For those of you who are interested in this program, the application process will begin in February 2023. You can check the update via the website, which have a QR code on the screen right now. If you have any questions during this session, you can click on the link on our Facebook Live comment to access a Google form and enter your email as well as questions. We may not have enough time to get to all of your questions today. What we will make sure to answer as many as we can as the time allowed. Without further delay, it is my honor to introduce our guests of the session. I will start with Associate Professor Dr. Chanchai Sittipan, Dean of the Faculty of Medicine, Chulalongkorn University. He is a prominent chest medicine doctor. He dedicates himself to advanced medical education in this country and has made every effort to push this program forward. He will introduce us on the vision and rationale of this international medical program.
Thank you, Ajarn Seri. Hello, everyone, and happy Chinese New Year. I'm Associate Professor Chanchai Sittipan. I would like to welcome you to the open house of the CU-MEDi program. First of all, I will introduce you some details about our university. Chulalongkorn University, or nicknamed Chula, is the first university in Thailand. Throughout the years, for over a century, the university has established faculties and also numerous research centers and institutes. For the Faculty of Medicine, Chulalongkorn University, we established in 1947. It's a prestigious faculty that offers a range of undergraduate and postgraduate programs, including an international medical program. The International Medical Program, also known as CU-MEDi, is a program that allows international and Thai graduates to study medicine. It is a 4-year program that includes both preclinical and clinical training in Thailand and abroad. Upon completion, students receive a medical degree from Chulalongkorn University. The program is designed to provide a high-quality medical education to students from around the world and prepare them for careers as medical professionals. The developed program is the first graduate international medical program in Thailand. Our strategy is to become a global medical institute, which will have collaboration from all over the world. Our faculty has a good reputation, good staff, and a good environment, which are all the foundation for our program. The program also encourages lifelong learning for our students in the program. This will prepare the students for becoming a 21st century doctor, where constant medical and technological updates occur. Also, our program welcomes graduates from all kinds of fields. This will create a unique learning environment for the students, which leads to one of the kind doctor in the future. The students in this program will have an international clinical experiences, which is essential for becoming a doctor in the near future. Our collaboration between other institutions from different countries will support the students to enhance their leading experiences. So, as a dean of this faculty, I would be more than happy to welcome you to join our program. I hope that this open house event will give you the insights of what we have to offer. With this, thank you very much.
Thank you very much ครับอาจารย์ฉันชัย for a clear vision and wonderful introduction of our program. Next, please welcome Professor Dr. Nijasi Chanalong Suwanwera. She is the director of the international program. She will talk about the pre-clerkship phase of the curriculum, which is the foundation and the most important steps to ensure bright future for our medical students.
Thank you very much. So I just want to add a little bit more that what our dean just said. Just want to let you just know more, getting to know more about CU-MEDi program, which is the first international medical program graduate entry in Thailand. So CU-MEDi actually stands for Chulalongkorn University International Medical Program, and as you know, it's an international graduate entry and requires a 4-year study time. So for CU-MEDi, we accept students who graduated from any field, any kind of field that you have graduated, you can enter CU-MEDi. And our goal is to produce a professional doctor who can work globally or locally. And they should be equipped with the 21st century skill and leadership quality. They can choose whatever kind of doctors they want to be. They can be a healthcare leader or a physician, engineer, scientist, physician, academic physicians, or any other things that they would like. So this is our outcome, the outcome of the CU-MEDi program. And we want our students to achieve these 12 outcomes. They should have the hands that heal, the head that is smart, and the heart that cares. So meaning that they should be equipped with doctor's task, giving correct diagnosis, choose the right investigation management, can do procedural skills professionally, and they should have quality of medical to become a professional doctor. More importantly, which is more specific to this program, is to be a global doctor with multi-talented quality and also 21st century skills. And they should be the leader of change. So our curriculum has gone through many kind of accreditation. So we were accredited by the IMEAC, which is in compliance with the WFME standard. It was approved by the Chulalongkorn University Council and also the Thai Medical Council. So next, I just want to share with you why CU-MEDi is going to be the right choice for you if you want to become a doctor. So we would provide 4 experiences, 4 types of skill. CU-MEDi is for good and also it's going to be for fun. For the experience that we're going to provide to all of you if you come and join us, these experiences will take place in different places. First is going to be at the pre-clerkship phase, which is going to take place at the Faculty of Medicine, Chulalongkorn University. And then you'll gain experience from the cutting-edge medical institution, which is the King Chulalongkorn Memorial Hospital. Then our students will gain more clinical experience at our affiliated hospital at Queen Sawang Wattana Memorial Hospital in Chonburi Province. And then we'll have experience on international healthcare in our affiliation abroad. So CU-MEDi, as mentioned by the dean, that this is part of our medical program provided by Faculty of Medicine, Chulalongkorn University. And then we have a regular program where many more students are studying. And this is our Faculty of Medicine, which is already 75 years old. And also it is part of the Red Cross Society. The Faculty of Medicine is working closely with the King Chulalongkorn Memorial Hospital and is located at the heart of Bangkok. You can see in this picture that all the buildings, the high rises over there they belong to the Faculty of Medicine and King Chulalongkorn Memorial Hospital. We are very close, just right next to the Lumpini Park, which is the biggest park of Bangkok. And we have SkyTrain just right at the corner. And this is the King Chulalongkorn Memorial Hospital, which is a state-of-the-art hospital in Bangkok. It's a big tertiary care that provide patient care. Another affiliated hospital is Queen Swang Watana Memorial Hospital, where our students will do their clinical rotation over there in their second and third and fourth year. So this is around 1.5 hours from Bangkok, and Ajahn Rungsak will mention more about that. But as you can see in this picture, it's very close to the seaside and very nice view and very nice facility. And these are some facilities at the Queen Swang Watana Memorial Hospital. They have a very nice medical education center. And more importantly, they provide the type of patients that are suitable for learning for our medical student. And the teachers and student ratio is very good. We have a good ratio so they can, the teacher or the instructor can take care of our students very closely. We also will send our students to abroad to the international affiliated hospitals in the UK and in the US. They'll have 8-week rotation as a clinical rotation abroad. And these are some of the affiliated hospitals that we have connection with. We are also honored to have our international advisory board mainly from the US, and they're helping us shaping the curriculum and helping our students. Just want to mention Professor TJ on the most bottom part. He's the most resourceful person and has been helping us for quite a while. And he's here with us today as well. So CU-MEDi will provide 4 experiences in different places. And also there are skills that we would provide for our students. So the skills would be the skills about basic science, clinical science, taking care of patients, humanistic medicine, which is also very important to become a doctor in the 21st century, and also a skill of doing research. So in our CU-MEDi program, we will have classes for clinical experience starting from the first month of the learning. So students can come and learn about real patient, and they can work back to the basic knowledge. So they'll be seeing patients in the clinic, in the operating room, and in different places. They'll be observing in the ER, outpatient, inpatient clinic as well. And these are some of the activities that has been going on for our students. And this, you can see that this is in the operating room. We also provide basic clinical competency and clinical skill classes. So students will have a chance to do hands-on activities. They would do physical exam on the simulated patients or the mannequin. They'll do some procedures starting off from the first month of the study time. And we have this CHAMP Center, which provides the learning environment for the students. We also emphasize on humanistic medicine, which is very important, as I mentioned earlier. Not just doing the skills and being a doctor, you have to have empathy to the patients, and you have to learn how to be professional as well. For research part, our students will have a chance to do a lot of research starting from the first semester. We have the course called Spatial Project in Biomedical Research, where students can choose to do any kind of research, maybe basic science or maybe clinical research or any translational research. They can also do any innovation that they want. And at the final year, the 4th year, they will have another 16-week rotation as a student-selected components, and they can pursue their research project, or they can do anything that they want in relationship to medicine. CU-MEDi is also for good. As mentioned earlier, that our Faculty of Medicine and Chulalongkorn University has been established for a long time. Chulalongkorn University is the first university of Thailand, and it's more than 100 years old already. And this is a picture of the university and the university emblem that may be familiar to you. Also, we provide some cultural activities like white coat ceremony from the first month of CU-MEDi program. The last part is CU-MEDi is for fun. Of course, not just learning. And we're trying to make learning fun as well at the same time. So our students will be provided with some questions, some clinical case scenarios, and they have to work on that case scenario. It's just like solving a mystery. So this is, I think it's fun to solve patient problem and work back to the basic science. Not only for the classes, we have other activities. This is the Chulalongkorn University activities. Students can join any club that they want. They can go to the football club or football team. They can join any musical like orchestra as well. And these are some facilities that we have at our Faculty of Medicine, and also some more facilities over at the Queen Sawang Wattana Memorial Hospital. So not only studying, they can enjoy their life as well. So, and this is one of the activities that we had at our with our team, core team, and the CU-MEDi students at Phetchaburi province, where we had our clinical experience there. So yeah, for now, I've share with you about our CU-MEDi program, and hope that you think this is interesting and want to join us to become part of our program. So we are looking for 40 students for the next year to come. So if you have already graduated your bachelor's degree in any field, we don't have any age limit criteria. And if you think that your English language is proficient, and also you have knowledge in medical, as you have to take the MCAT exam, and more importantly, you need to be passionate in medicine. You have to have full commitment. This is not a part-time job. It's a full-time learning time. So you need to be very committed to the program. And you feel like you are an adult learner. You want to have a lot of self-studying. You want to work with your friends and the instructors. You might be the one who want to join our CU-MEDi program. So we just opened up our admission time for the third class of our CU-MEDi students. So usually it starts in February, and it changes every year, the exact date. But for this year, application will start on the 1st of February until the 27th of February. And we will have the interview on the 4th of April. So if you already prepared, already got your MCAT score, you can just apply for to us starting on the 1st of February. So these are the admission criteria. So of course, you have to finish your bachelor's degree. Any field that would be okay. You need to take either TOEFL or IELTS to make sure that your English is sufficient. And you have to take, of course, the MCAT test, which is the medical college test for the U.S. Medical schools. And then you have to send us your CV, your statement of purpose. We need to letter of recommendations. And then you send us a transcript, and we will look at those items and ask you to come for the interview later on. And these are some of our CU-MEDi core team. Of course, it's part of the Faculty of Medicine, so we have the whole Faculty of Medicine supporting us, and this is some part of it, of the team, and this is our CU-MEDi core team who have been working very hard with this program. And for that, if you have any further questions, we are happy to answer your questions later on. And also, you can contact us by this email or just contact our office. Thank you very much.
Thank you, Khabachar Nichasi, for the wonderful talk and introduction to our program. Now, after the students finish their pre-clerkship phase, students will gain their clerkship phase both at King Chulalongkorn Memorial Hospital and Queen Sawang Wattana Memorial Hospital. I would like to take this opportunity to introduce Associate Professor Dr. Ruangsak Lerkhatornsuk, the Deputy Director of Queen Sawang Wattana Memorial Hospital, where our students will gain most of their clinical experiences.
Thank you, Ajahn Seri. Good afternoon, everyone. I would like to present about the life in clinical years of CU-MEDi student. The clinical setting of CU-MEDi student will learning in the Queen Sawang Wattana Memorial Hospital or โรงพยาบาลสมเด็จ Paromrachachoni Nasiracha in Thai. This hospital is located in Sriracha district, Chonburi province, about 1.5 hour drive from Bangkok and about 1 hour drive from Suvarnabhumi airport. It's very close to the Eastern Economic Corridor and very beautiful city. And Queen Sawatthana Memorial Hospital at King Chulalongkorn Memorial Hospital are under the same umbrella of Red Cross Society, so they are working seamlessly and they have many collaboration like academic research and medical service. So we believe that our students will have the very efficient teaching and learning there. The new building that we just opened last year is the 150th anniversary of Her Majesty Queen Sri Medical Center. This is a 26th floor medical center which have comprehensive outpatient and inpatient service in one building. So the working of a medical flow is very fluent and I believe that medical student will have the very well-equipped medical equipment here, and you can see the spacious of the patient area and also the medical service area. Of course, we provide the area for medical teaching here as well. Close to the medical service center, about 50 meters, we have a medical education center which close to the seaside. The Medical Education Center, we have a very big lecture hall and also a small room for small group teaching. And another simulation center at the upper floor, so medical students can practice the simulation situation before they encounter the real situation with patients. So this building will take place when students will have a learning period here, and when they work in the new building. And you can see the view from our lecture room. After the long learning period, students can have a very beautiful view in this building. For the dormitory, the Vaitayanivet dormitory, which have a very well-equipped facility. We have the convenience store in the ground floor, and you can see the twin bedroom, which equipped with air condition and water heater. Also the recreation area and the place for common room for medical students to have some self-study apart from the learning period. The clerkship will start from the fourth semester. It takes about 1 year. That means semester 4 and 5 is the clerkship period, which contain the major clinical discipline like OBGYN, pediatrics, medicine, and surgery, which will take place in Queen Sawatthana Memorial Hospital. And also the integrated rotation, which will take place in King Chulalongkorn Memorial Hospital. After they spend 1 year of clerkship, the student will go through the externship with starting from the semester 6 to 8. It takes 1.5 years. In the externship, student will act as a real doctor with the medical team. They got the clinical rotation in the every ward like clerkship, but they work like a real doctor. Most of them occur in Queen Sawatthana Memorial Hospital. And also the enrichment period, it takes around 6 months for students to search for their interesting and maybe abroad. So this is the freely elective for this program only. We just finished the first rotation of CU-MEDi student in the first group last 2 weeks, and this is a picture of our student. This is at the ward work for medicine wards. They working as a team. The treatment team consists of a senior doctor and residents and also extern, and our CU-MEDi student will be the youngest of the team. The first day of rotation begin from the 6th December last year. You can see how eager for them to join the work here, and also they look very happy. They take a picture with our director of hospital, and also they pay respect to Queen Sri Sawintra who is the founder of our hospital. In outpatient clinic, they can have a history tracking and a physical examination and observe the staff, the teaching staff for take care of the patient, and also have patient education in the outpatient segment as well. In orthopedics ward, apart from attend in the clinical ward and the operative room, they can practice the basic medical skill like the splint, and also study some landmark of the orthopedics in the workshop. For surgery, they can practice the basic medical skill like suturing in the mannequin, and they also practiced in the real patient in the emergency room. We cannot have a photo in the emergency room because of the patient confidency. Apart from the clinical rotation, they also have simulation workshop like venipuncture or the basic life support in our simulation hall in the medical education center as well. After the learning period, they have the self-directed learning period. In mostly they have the SDL in a common room in the dormitory. You can see in the middle of the picture, last year they can have SDL along with the FIFA World. So they can attend either entertainment and self-directed learning at the same time. They also have some life after work because of Queen Sawang Wattana Memorial Hospital have many green area. They can have some picnic and also the party here. I would like to present the short message from our CU-MEDi student at the first rotation.
My 1.5 months here has been an unforgettable experience. The hospital is well equipped and the professors are so supportive inside and outside of the class. I couldn't express how lucky I am that they dedicated the time to prepare for our lessons. They welcomed us like family and took us in. We are more than lucky to be here and we look forward to coming back soon.
And this is a thank you card that they sent to our instructor about the impression for the instructor and the environment here, appreciation about the teaching process. And we are looking forward to see you all. Thank you.
Thank you so much, Kapatan Ryung-sak, for the wonderful overview of the hospital. I'm sure the student will gain a lot of experience from the hospital, and honestly, hopefully they have some time to enjoy the view at the beach. It's really breathtaking. For the next part, I'm honored to introduce Professor Dr. Thanakon Jirasewi Jinda, or what I know, Ajahn TJ, our program coordinator. He's a pediatrician at Cornell. With expertise in medical education, he will tell us about strength of a program and what this program has to offer. He will join us via Zoom.
Celebrate. And secondly, I wanted to really congratulate the team of educators and administrators who put together a wonderful program, CU-MEDi, and the program which has really going on to its third successful year. And I think congratulations are really in order for all the hard work that the team has done. I think I wanted to limit my message to two big areas. The first area is really as an endorsement. And the endorsement is based on my, from December 2021 to May of 2022, I was privileged to serve as a curricular consultant as part of my Fulbright faculty scholars program. For 6 months, I had the pleasure and privilege of working and collaborating with the team members at CU-MEDi. I was really impressed by so many things. One is really the dedication to education and professional development, as well as the personal growth of all the students. They have also put together a very thoughtful, engaging, interactive curriculum that in many ways foster independent learning, lifelong learning, and really collaborative in educational experience and environment. they really have a huge emphasis on the humanistic quality, humanistic aspect of the practice of medicine. As students, you get a lot of individualized attention from the faculty and from each other, right? Learning in a group. And lastly, the uniqueness of this is when students who are graduate entry level students, after studying and finishing with a undergraduate or baccalaureate degree in any field, right? Students come in with really diverse experience, diverse skills and perspectives, and really, being impressed with the engineers who have done team-based projects, etc., or from students from the arts who are really creative and visual thinkers, and putting everybody in that really collaborative environment is very unique and a wonderful group learning experience for everybody. So other than the endorsement, I wanted to just add that, another unique aspect is the international clinical experience, right? If we all can imagine, medicine is a team-based, is a team sport. The practice of medicine is not just one doctor doing so many different tasks, but really, how does a doctor function in a very interdisciplinary environment, right? Collaborating with nursing staff, collaborating with radiologists, the surgeons, different specialties, respiratory therapists, and so many others that I have not even mentioned. So I think, having that kind of requirement to work in a team setting requires a lot of experience doing that. And I think secondly, Ajahn Nitasi showed the slide about the different competencies or the outcomes of the training. So by the time you finish as a graduate, you will have had acquired, demonstrated, and mastered some of these competencies. And so with those two backgrounds in mind, I think the international clinical experience really is a wonderful way to apply some of these competencies and skills that people have learned, right? So going overseas is not limited to learning about the medicine, the knowledge, and the application of knowledge, but it's really thinking about working in a diverse environment, in a group setting, right? Learning about the systems of practice, the healthcare systems of different countries, learning about how to work in a group setting, learning about how to communicate with different diverse members of the team. How do you work together towards a common goal, a patient, quality, the optimal outcome for the patients, and really to make connections of, other trainees overseas, faculty overseas, and really using them as resources, and thinking about how that can enrich you as an individual, as a professional, as a provider, and or as leader in the future. And I think that, in many ways, not only enrich you and help you foster and develop your competency and your personal and professional identity, but really that connection hopefully will help you open doors for you to your future, whether it's residency application and or future career practice as well. So I wanted to say again, congratulations. Thank you for inviting me to be part of this. I am excited to continue working with this wonderful program and looking forward to seeing more people join. Thank you.
Thank you, Ajahn TJ, for your endorsement and nice word. Ajahn TJ is really one of the key persons of our curriculum, so he knows it very well. Now, let's take a sneak peek at our program from the student's perspective. Here, I have a short video clip to see how it is like to study in this program. The video clip is by our student. Will show the atmosphere and facilities while they're working and doing their clinical years at Queen Sawang Watana Memorial Hospital.
Yo. So we're approaching the Queen Sawang Hospital right now. Yeah. And so on the car we have Indy driving. Hello. We have Nick. Hello. Hi. Hello. Non. Hi. And Point right here.
Hi.
Okay, so this is the area around the hospital with all the food. This is the Marina Bay. Amazing food over here.
Very nice, very nice.
What we absolutely love about this dorm is just how near the dorm is to the hospital. I mean, they're literally 3-minute walk apart. So I'll show you right now just how close the two buildings really are. Let's take a look. So we the boys?
Dormitory called Hawaii Way.
Okay.
You see, it's only a couple of hundred meters away from the actual hospital. The total walk itself is around 30 seconds to a minute walk.
Okay, okay.
And
Very
there's a
convenient.
7-Eleven right here, open till 10 p.m. at night.
Very convenient.
If you want some snacks or some coffee in the morning, go ahead and grab one. And there's an ATM machine as well.
And what do you think about the room here that they have for us?
The room here is honestly surprisingly clean. Like,
Yes.
I did not expect to have my room being this nice and clean. And we'll see in a second. Oh, also there's a rehab center over here.
Okay.
More of a massage place. Where,
Okay.
You know, you get office syndrome or you get tightness from studying all day. You can go ahead and come here for a visit. You know?
Right on.
So now we're at the 3rd floor on the A side, which is the side for CU-MEDi people, and it has a total of around 8 or 9 rooms. I don't remember, but basically, each of the different rooms is 2 students each room, and we all have roommates. And one thing that's nice about this room is that it has an access to a laundry service. So I'll show you over here in front of our room. Here is our bedroom, my room and Joel's room. These are our beds. That's the balcony area, and this is the desk that we normally work on. Pardon me for a little messiness. So we're moving out.
We're moving out to July tonight.
Yes, sir. And these are our closets. This is a usual closet.
Okay. And what about laundry? How do we do laundry here?
So interestingly, we have an access to the laundry service. So we put our clothes or used clothes out here, and the service person can access it from the outside without having to unlock the door.
And all we do is we have to line the person, right? Give her a line message, and she will come and get it. Give her 2 to 3 days, and she'll be back with the fresh, really nice clothes for you.
So convenient. Only takes around 2 to 3 days.
Exactly.
Where to next? Almost forgot. So this is our bathroom, right?
Hello.
So here's the sink. Here's the toilet. And here's the shower room. Very nice and spacious shower room.
Indeed, indeed.
Alright.
And coming up to the 14th floor, I'm going to show you what we have here, the fitness room, which is probably my favorite place in this store. It has got everything you got here. Now, we've got our buddies doing the weights. We've got the treadmills, we've got the dumbbells, we've got the bar for you to do your pull-up. And the best part about this fitness room is the very view. I mean, there's nowhere else we're going to get this kind of view in this area. This is the best you can find in this hospital. Take a look at that. Beautiful. So I'm very excited to invite all of you to come join us in Queen's Hospital. I wasn't sure about this place at first, but after having been here for a month, I can tell you right now that I absolutely love this place. Thank you very much, guys. Woo!